Hey everybody, Dr. Rai here. I'm here with Dr. Darren Sass from Insight Optometry and Occupational Therapy. We're going to answer some specific questions that a lot of parents have in our office, and I'm sure outside of this office today. But before we do that, Dr. Sass, tell us a little bit about yourself and your clinic here.
Well, we're in Walnut Grove. We are primarily a pediatric eye clinic, but we do see adults, particularly those with neurological issues. But primarily we work with smaller children.
Okay. And speaking of children, one of the main questions, actually probably the number one question I get is how old or how young should a child be before they get their eyes checked?
Well, generally for regular comprehensive eye exams, 6 months is a pretty good age to start with. At 6 months, kids' eyes should be working together as a team. They can sit up, they're a little more social, so 6 months is an ideal time. But if there are any obvious concerns, we'll see kids younger than that.
Okay.
And then afterwards, just for routine care, about every year, it seems to work out best for most children.
Perfect. Now, what are some signs that parents should be looking out for when they suspect there may be some vision issues?
Well, the big ones are, possibly vision or life-threatening health concerns. And they may get a screening at birth, and sometimes they don't. We have a number of parents that have often picked up on problems with photographs where you'll see one eye glinting more than the other. That would be a big concern and not to be ignored. Eyes that are not working together as a team is another pretty obvious one. Any red or weeping eyes. And then sometimes it's more behavioral. Kids that have trouble learning to walk sometimes, kids with attention problems are more likely to have eye problems. The most common eye problem, or the most common childhood handicap, is amblyopia, and unfortunately it doesn't give any signs whatsoever. It's only detectable through an eye exam. So that's why we push really hard to have your children's eyes checked by a professional.
Okay. Now, a child has prescription glasses now, and a lot of times parents aren't the biggest fans of the fact that kids have to get their glasses or their prescription glasses. What would you say to that parent?
Well, glasses can be prescribed for a number of reasons, but primarily they're prescribed in order to promote child development. And so vision problems are so ingrained into our behavior and our learning and our child development that the wearing of glasses seems, to me anyways, a little less of a concern. Definitely from the children's standpoint, though, it can be a big deal. We tend to push consistency. I have yet to see somebody successfully force a child to wear glasses, but we consistently reinforce the wearing of them, and eventually they reach a point where they start to see the value in them.
Okay. And lastly, what are some things that parents can do to help promote good vision for their kids?
Well, that's changed over the time that I've been practicing, I think. For particular vision problems, we do treat them with lenses or with exercises, but primarily what I'm interested in is preventing the vision problems in the first place. And so we think a lot about giving your child a broad experience, and so we've shown that even an hour per day outdoor time has a positive effect on vision.
Okay.
Definitely avoiding electronics. The iPads and cell phones seem to be about the worst thing that we found for the children's eyes and their behavior. I would really reconsider the use of tablets and cell phones, and to some extent, pushing books. They have high entertainment value, but they may be teaching your children exactly the opposite to what you think they should be learning.
Got it.
So avoiding static activities where you're sitting still and staring for long periods, promoting outdoor stuff where you're using your vision to move. Vision's primary purpose is to guide movement. So pretty much any activity is going to be helpful for vision, but I particularly like bike riding, swimming, any symmetrical bilateral activity, which probably similar to activities you might recommend in chiropractic.
Absolutely.
You know, vision's not a isolated system, it's involved with all the other systems.
Absolutely. Thank you. Thank you very much, Dr. Sass, for all that insightful information. If you do want to have more information or you want to reach out to Dr. Sass, Insight Optometry and Occupational Therapy here in Langley, we'll see you next time.